I'm Dr. Brette Harding, and I am an assistant professor here with the Department of Otolaryngology, Head and Neck Surgery here at SIU. I am a head and neck surgical oncologist and microvascular reconstructive surgeon. So I'm from Appalachia, Virginia. It's a really small town in the Appalachian Mountains in the very far southwestern corner of Virginia. Outside of medicine, I actually am a really avid sports fan. My husband and I, we really keep up with the NFL, college football, college basketball, big Kansas City Chiefs fans, as well as Pittsburgh Steelers fans, mainly my husband. And then our college teams are University of Virginia Cavaliers and the Notre Dame Fighting Irish. I went into medical school thinking that I was going to be a primary care physician or a pediatrician. But once I got into anatomy lab, I realized that I loved the anatomy, the surgical skills. And so my idea of what I was going to do started to change. And especially when we had our second anatomy block, our neuroanatomy block, then I really fell in love with the anatomy of the head and neck. I actually really wanted to go into ENT because of head and neck cancer. And so kind of figured that out early in my third year of medical school, or maybe even second year, I guess, when I was exploring these specialties, but kind of confirmed that during my third year of medical school and hadn't really changed my mind ever since and kept on the pathway. And now here I am as a head and neck cancer surgeon. Even though I technically am an ENT and ear, nose, and throat surgeon, I am fellowship trained in head and neck cancer surgery, as well as microvascular reconstructive surgery. And so because of that, it makes me more focused specifically on head and neck cancer or tumors of the head and neck, whether that be cancer or non-cancer. But that's essentially my entire practice. I don't do anything else related to ear, nose, and throat surgery. I only focus on head and neck cancer. We have everything that a lot of large programs have, including extremely well-trained and excellent surgeons and physicians from all the disciplines that care for head and neck cancer patients. And we have that right here in Springfield, in an area, in a hospital system that's really easy to navigate and not very overwhelming. And when you are facing your cancer diagnosis and your cancer treatment, just being overwhelmed with having to, go to a parking lot, ride a bus, get to this one institution, have to walk over to another building that, our patients don't really experience that here. So they're getting the same level of care that they would anywhere else, but in a much more manageable, less stressful system. And I think that's a really big plus for our patients.